Assalamualaikum. My name is Nurul Elis Natasha binti Muhammad Hardi Effendi and my matric number is BPT 122300004.
Assalamualaikum warahmatullahi wabarakatuh. My name is Nur Mafaza bin Muhammad Amin and my matric number is BPT 1223005.
Assalamualaikum, my name is Nohafika binti Zaini and my matric number is BPT 1223007.
Today, our group will explain about topic pharmacogenomics and personalized medicines. Pharmacogenomics is the study of how a person's genes affect how they respond to medicines. It is also known as pharmacogenetics. This is important because everyone's genes is different and this can change how well a medicine works or if it causes side effects. And personalized medicine is a way of giving treatment that is designed specifically for each person. It uses their genes, lifestyle, and environment to choose the best medicines and the right dose to make the treatment work better and safer. The mechanism of pharmacogenomics involves two main aspects, which are pharmacokinetics and pharmacodynamics. Pharmacokinetics refers to how the body processes a drug, including absorption, distribution, metabolism, and elimination. For example, the CYP450 enzymes in the liver play an important role in breaking down many drugs. A person's genetic makeup can determine whether these enzymes work quickly, slowly, or at a normal rate. If the enzymes work too quickly, the drug may not be effective. On the other hand, if the enzyme works too slowly, the drug can build up in the body and cause side effects. Meanwhile, pharmacodynamics focus on how a drug interacts with its target in the body, such as enzymes or receptors. Genetic variation in these targets can change how the drug binds and works. For example, warfarin, a blood-thinning medicine, works by inhibiting the VKORC1 enzyme to reduce blood clotting. Genetic variations in the VKORC1 gene can make the enzyme more or less sensitive to the drug and affecting its mechanism of action. This is why genetic testing is used to adjust the dose and prevent complications like excessive bleeding.
Pharmacogenomics and personalized medicine are transforming healthcare by tailoring treatments to individuals, improving effectiveness, and minimizing side effects. In precision antimicrobials, pharmacogenomics addresses multi-drug resistant infections by analyzing the genetic makeup of bacteria. For example, in multi-drug resistant tuberculosis, pharmacogenomic testing helps select effective antibiotics like bedaquiline, improving recovery and limiting resistance spread. It also guides the treatment of infection like MRSA using targeted antibacteria to avoid the overuse of broad-spectrum drugs. Cancer therapy uses pharmacogenomics to customize treatments based on genetic mutation in cancer cells. For non-small cell lung cancer, patients with specific mutation respond well to drugs like erlotinib and gefitinib, which target mutation directly, improving outcomes and reducing side effects compared to traditional chemotherapy. Psychiatric care personalizes treatment for conditions like depression and schizophrenia, considering genetic variation in drug metabolism. Variants in genes like CYP2D6 and CYP2C19 affect how patients metabolize antidepressants and antipsychotics, enabling healthcare providers to choose the right medication and dosage, improving outcome and reduces trial and error in prescribing medicines.
So now I'm going to talk about the challenges and future trends for pharmacogenomic and personalized medicine. The challenges are the need for robust genetic databases and ethical consideration and cost effectiveness. And the future trend are robust genetic databases for pharmacogenomic in anesthesia and cost effectiveness of precision medicine implementation in clinical practice. For example, in anesthesia, it's very important to focus on patient genetic factor before putting them into anesthesia, as some patients might require a high dose and some might require a low dose. Therefore, it's important to do some research for it to modify and tailor precision in the drug selection at the right dose for the right patient. And it must have affected the cost for doing all of this due it to tailor and modify require high-tech machine and skill that can cost money. All of these are important to enhancing patient safety, reducing complication, and improving recovery outcome.
In conclusion, pharmacogenomics studies how genetic variation impact drug responses, revolutionizing personalized medicine by using genetic information. It tailors treatment to maximize effectiveness and reduces side effects. This approach has been applied in cancer, mental health, and pain management, improving patient outcomes. As genetic testing on targeted therapies advances, the field will expand to treat more conditions. However, challenges like high costs, ethical concerns, and the need for larger genetic databases remain. Despite these, pharmacogenomics offer a promising future, improving the precision, safety, and effectiveness of treatment for every patient. Thank you.